Dr. Amy Rogers and Dr. Michelle Rassa-Majors will be sharing some insight regarding dealing with stress. Let me introduce our host. Dr. Michelle Rassa-Majors is one of the founders of the Culture of Care Summit. Thank you so much for that. She is also a professor and assistant dean in the College of Arts and Sciences. And as a scholar, Dr. Rassa-Majors has published and presented in both national and international peer-reviewed journals and conferences. She is an author, a co-author of several publications. Her research interests include leadership development, online teaching and learning, academic voice development, cognition, faculty engagement, and motivation. And we also have Dr. Amy Majors. Amy has been with our institutions for 12 years, 8 years as full-time faculty, and the last 4 years serving as the Director of Strategic Partnerships, working with our community college partners in support of transfer students. Amy is married with 2 grown children and 4 grandchildren, and she loves to spend time adventuring in nature with her husband and their dog. Thank you so much for joining us today.
Thank you, Dr. Smith. Really appreciate the introduction. And Dr. Rogers and I are both very excited about being here today. I want to get us started off by explaining that our session is very much one of comfortable stories of a couple of things that happened to both of us based on stress and things happening in our lives that really kind of threw us both for a loop. And so we want to share with our colleagues and those outside organizations the importance of really listening to yourself by first just sharing our stories. I know for me, last year I was asked to share my story and I wasn't ready yet. And so I thank Amy a lot for joining me today and having this really important conversation about those of us that do lead and manage and are very active about the importance of, sharing our stories and taking care of one another in that light of culture of care. So for now, I'm going to turn it over to Dr. Rogers and let her tell her story first. Thanks so much, Amy, for being here.
You're welcome, Michelle. Thanks for having me. You hit the nail on the head on readiness. No one can really determine when that's going to happen, but I am really actually anxious and excited to share my story, and I want to echo what Michelle said, that this is not a session full of medical advice. What I am sharing today is simply my story in the hopes that you might find some part of it that resonates, challenges, or even empowers you. I also want to say that this isn't important for just women to hear. Any man who knows a woman will benefit from this, and I'm happy to see a few men in the session as well. I'm going to go back in time, and on July 7th, 2024, I was walking my dog through the park, like I always do. It was a quiet, normal morning until it wasn't. And out of nowhere, I felt a strange wave of energy move across my chest from left to right, and simultaneously through my upper back and shoulders. I wasn't quite dizzy or nauseous, but I was overwhelmed by this intense sensation that made me hightail it out of the park and get to the street so that I could sit on the curb, because I was afraid I was going to pass out. I could see my house probably 75 yards away, but I knew I couldn't make it there. I sat there and tried to be as calm as I could, and I looked at my Apple Watch, and strangely, my heart rate never changed. But whatever the episode was, it lasted about 3 minutes, and it launched into a summer of what I came to call the weirdness. I started logging the weirdness episodes daily on my notes app. They came and went. Sometimes I would have the blessing of a few days.
What you gonna eat? Sandwich?
Between episodes. And then as it progressed, I could have 5 episodes a day, sometimes even waking me up at night. By July 23rd, I was undergoing cardiac tests, including a contrast CT angiogram. And then while I was on vacation a few weeks later in Idaho, I got the call that surgery to repair 2 arteries was likely. I got home a couple weeks later, and on the Friday of Labor Day weekend, my cardiologist, someone who I had seen for 5 years, told me he'd be performing a traditional angiogram on Labor Day. He didn't want to waste any time, but he wanted to see for himself something that showed up on the contrast angiogram and something that he admittedly missed 5 years before. You see, back in 2018, I was awoken from a dead sleep with what I thought might be a panic attack. I'd never had one before. I didn't have any pain, but my heart was racing and it wouldn't stop. I went to the ER and subsequently, a few days later, had an angiogram that revealed an anomaly in one of my arteries. But my cardiologist was focused on blockage. This is something he shared with me now. And since there wasn't any, he moved on. He didn't give the congenital mutation a second thought. And it's something that I now know only 1% of heart patients have. And since those 5 years, I had developed over 70% blockage in the left anterior descending artery, also known as the widowmaker. Anyone who knows me knows that I'm very active. I take good care of myself. I hike, I work out, I eat well. I'm not a saint, but I take care of myself. I go for regular checkups. If this could happen to me, it could happen to anyone. And I don't say that to scare you, but a little dose of real reality for me. By September 27th, I underwent open heart surgery. Using a mammary artery, they bypassed my right coronary artery, the one that was being squeezed between my aortic and pulmonary valves since birth. They also bypassed the blocked left anterior descending artery. The 8 weeks of official recovery were a blessing in disguise. Stillness, reflection, and some recalibration. But the truth is, this is a long journey. 6 months later, tomorrow, I'm still healing. My sternum, the numbness on the left side of my chest, and a ripple effect across my body that neither my cardiologist or my cardiac surgeon told me about. I've had a long time to be able to think about stress. And the past 5 years, leading up to this event and between the two events, have been some of the most stressful of my life. Some of it typical, like we all experience with our jobs and lives, and some of it not. And what I've come to realize that being an empathic person, someone who feels all the feels, has a huge impact. I have carried stress in my body in ways that I didn't understand until now. And here's what I've learned that I want to leave with you today. First, women's heart symptoms can be so different than men's. No crushing chest pain, no collapsing in the gym, just weirdness in my case. And we have to listen to that. And I want to note too that what I described to you on that day in July and the days after was not a heart attack. Thankfully, I did not suffer a heart attack, so I did not have damage to my heart. The second thing I want to leave you with is to advocate for yourself. Be persistent, ask questions, take notes, get second and third opinions. Your life is worth the convenience of being labeled as difficult. Third, self-care is not selfish, it's survival. And if you look up selfish, selfish does not mean what we think it means. It means taking care of yourself. I now prioritize my self-care before work, before everything else. I protect my sleep. I walk away when I need a break. I don't power through things like I used to. Fourth, managing stress isn't always as simple as journaling or yoga. For people like me, deep feelers, stress sticks, and sometimes it's invisible. It doesn't always look like crying or yelling. Sometimes it's just carrying too much for too long. Fifth, menopause. It's a word we still whisper, but it has an enormous impact on our health, and our heart health in particular, and your overall wellness. We need to talk about it more. We need to educate ourselves and each other. And finally, there are so many alternative resources out there. I am finding help not only through my new cardiologist, who is also a naturopath, but also from a functional medicine doctor. I read, I research, I explore the mind-body connection more deeply than I had before. And because of that, sometimes I get overwhelmed with all of that, and I step away and just let myself be for a while without inputting too much information. So what now? I am still recovering. I am still and always will be learning, and I'm giving myself grace. I have learned not to hold my body to impossible standards. I am learning patience with my progress and to be kinder to myself for that. And I'm learning that normal may never be what it was for me, but it is still going to be grand. I also know that stress is always going to be there, but I don't accept it as a default setting, especially when it comes to work. I've always been pretty good about that with my personal life, but especially with work. I deserve better than that, and you deserve better than that. So I encourage you, when you get the resource list from Michelle and I, to take a look through it and look for some of the non-traditional resources that I've included on there. And I invite you anytime to reach out to me via email or call. I am happy to have a casual conversation with you about anything on that list and anything that you'd like to explore more deeply about my experience. I'm happy to share. Thank you.
Thanks for sharing that, Amy. I think when I share my story, that's probably the first word that's going to come up for people is that's weird. And it's just so important for us to share the weirdness and be willing to talk about it. And I'll just, before I start my story, say ditto to what Amy shared. We are resources for you, and we want to talk about it. We want to prevent this from things like this happening to others, because it does change your life forever. And so to start out my story, mine is a little different than Amy's. In September of 2023, I woke up early on a Friday to mow the lawn before I went to work. And I stopped to take this quick break. And then all of a sudden, yes, weird, I had this strange sensation like I had swallowed a cup of black pepper. It was so strange. I quickly became short of breath after that, but just thought this is weird. And I went inside to get something to drink. But I just knew something didn't feel right. So then I started to have pain in my right jaw, not left. And my panic, instinctive nature kind of went to knowing my family's history of stroke. And so I went in and I took some baby aspirin. And I'm like, okay, this can't be anything. It's just got to be panic. I sat, I laid down, I tried to take a bath, did all these things, but the pain just kept increasing down my arm. And I could not get the taste of black pepper out of my mouth. So finally, I realized that this was not good. And whatever was happening, that I needed to do something about it. And so my husband, I live out on a ranch. I got in our ATV, and I, in all the pain, went out to find him. And he said, "What's wrong?" And I said, "We have to go to the hospital." And he said, "Who's hurt?" We have 5 adult children and 3 grandchildren. And I think that's where my head would have gone too. And I said, "No, I think I'm having a heart attack." At this point, my chest had started hurting. And so we got back to the house. He dumped me in the truck and we drove to our nearest hospital, which is only about 10 minutes away. They got me into the room immediately. They gave me all kinds of meds to deter a heart attack, if that's what it was, but they weren't sure what it was. My husband kept telling them that if I was in pain, then something was wrong because I have a very high tolerance to pain. And they were very, very kind, but they just kept acting like this wasn't what I thought it was. So there was a little part of me that was embarrassed. Was I having a panic attack and thought I was having a heart attack? What was happening? And so as they assured me of this, they also said, but we can't let you go for at least 2 hours because there's this blood work test that will tell us definitively or not if you were having a heart attack. So we waited, and we waited some more. And I was feeling better with all of the different meds that they'd given me to stop a heart attack, take me out of pain. And all I remember is the real craziness that happened when they got this test back. I never saw the doctor in the ER again. They sent some other doctor in to see me because that doctor had constantly told me they really, really thought it was just anxiety. And this new doctor came in and said, you have to go to the Oklahoma City Heart Hospital immediately. The numbers were off the chart, something they weren't expecting at all. So in the meantime, they're dealing with me. They're trying to find, they had to have specially trained ambulance workers to take me to the city in case I had another event. Once I got into the ambulance, I wasn't in pain anymore. It was very surreal. I was looking out the back of the ambulance and I'm just thinking, what is happening? And I remember in the hospital calling work. And that was my first worry, is calling work and saying, I'm not going to be at work today. They think I had a heart attack. And of course, everybody was so kind. But again, it was so surreal because for a couple, 2-3 hours, I was thinking it was just anxiety, what was happening. So they got me to the hospital. They got me to the heart hospital and talked to the cardiologist surgeon who was going to do my CT angiogram the next morning. And he explained that he felt like from all of this, the things that were identified, that I probably had put a tear in my heart. And I had asked him, what causes this? And he said, it's a lot of different things, not unusual with women who are very active and love a lot and do all these things, and just reassured me that it was okay. The next morning, I woke up really early for the procedure. The hospital was fantastic. I was talking to my husband, he spent the night, and I was telling him, this doesn't make any sense. I get a lot of exercise on our ranch. Like Amy, I try to eat clean. I do a lot of my own canning, my own food growing. I'm a doer, so I'm always active. I have a hard time sitting down. We'll talk about how I changed that, but it just didn't seem possible that I was sitting in a heart hospital getting ready to go in, and they had told me if they found something, they were going to do something about it immediately. And they did the angiogram, came back out, and they said, there's nothing wrong. Nothing caused that we can see caused this, and you don't have any damage. Most likely because you got help so fast. But still, my mind was just, it truly is still traumatizing today, just going, then tell me what happened. How did this happen? And they said, some women just love too much. And I was like, wow, okay. I am a fix-it person. Anybody that knows me knows I'm a fix-it person. And so I had a lot to think about when I went home. And so I had to take a week off. They asked me to rest. That was not easy for me, not being at work. We had just actually started our planning for the first Cultural Care Summit. And it was actually a bit stressful on me to have to not do that. And the whole time I was just so scared of what happened. How did this happen? And so, I went through months of not traveling, not leaving my home. I was scared something would happen. I canceled an international trip with colleagues where they went. I did not, because I just didn't understand if this was going to happen again. What was I going to do? How could I get to somewhere fast enough? And could it really be stress? Really? The other thing that happened when I came back is I really had a need to share this with colleagues. I was pretty emotional about it all, but I felt like I needed their support Most people know I work a lot. I'm very close to my colleagues. But I also need to stress to them that stress is a silent killer that we don't even realize is happening to us, even when we're healthy. But it was hard. The people were scared to ask me, didn't want to intrude, those kind of things. And so I perceptively, even though it was my own personal, and I don't think anyone else, felt like, oh, I'm not supposed to talk about this at work, that this happened to me. And sometimes I kind of make myself talk about it. And then I just felt like people in the room were very uncomfortable. And that was probably harder than a lot of things. Since then, I've learned to say it's not my circus a lot more. I had so many people that offered me options for relaxing. I've learned to enjoy things that make me slow down. I oddly now knit and crochet, especially when it's cold outside. I continue to do my gardening. I'm not afraid to travel anymore, finally, but it did take a while. So, my takeaways for all of you, women and men, we can't take in our busy lives anymore our personal out of work. We're a holistic people. And to be healthy to serve those we serve, we have to support one another in all kinds of dynamic ways. So be okay with having those conversations and checking up on each other. It's okay to care. And I think for so long, we haven't been okay with that. And specifically, especially to my women friends, don't let someone tell you you're having an anxiety attack, that you're overreacting, or just plain ignore you like this was no big deal because they said it was stress and not a clogged artery. There were a lot of blessings that came out of it, not just for me. I had another colleague who actually went and had a checkup and feels like my event helped her. That's what I want from this. And I want everyone to hear that our lives are personal, they're real. When we care about one another, and Amy mentioned being an empath, especially when you're those type of people that care so much that you lay up at night wondering how you can help that person the next day, sometimes you have to let go of that burden. And how you do that is really up to you. And for the men out there that love your women, be there for them. Support them through their stress. They do hold stress, I think, sometimes different than men. I think men can do it too, though. We know all human beings out there that carry stress like this. But did I ever think, because I was a stress person, that would cause a heart event for me that took me straight to a heart hospital for surgery? I didn't. I just know I care about telling people to be aware of what's happening in your bodies. Listen to your bodies. Don't let the world drown out what you're feeling. Don't let the world also, though, because this was hard for me, quit caring. We have to care, but learn how to manage that, however that looks in your own life. And so, again, we're going to give you a PDF of some different resources. And we know this session was very different, but care isn't just a word, it's an action. And what that looks like for people, it differs. And so just remember, listen to yourself. Don't let others determine what's happening to you. Be your own advocate, whether you're a leader, employee, mom, grandma, student, sibling, whoever you are out there, listen to yourself and take time for yourself, because I learned the hard way. It really does matter. And I think Amy and I'll take questions now. We just appreciate you all listening to our stories.
Thanks so much, Dr. Majors. It's really significant because my mom had 11 strokes, one heart attack, and the heart attack, I believe, took her out, and she died, as you all know, in August. But one of the things I was most concerned with, and I have posted the PDF as a link here. Would you also like me to share the screen before I ask the question?
Sure. Whatever you want to do.
Sure. So one of the questions that I have for both of you ladies is, when you say you felt these changes in your body, did they start in a specific area or a specific place of the body, because my mom had a lot of what they call TIAs, mini strokes, and she would lose sensory perception. And that was one way we knew a stroke was about to happen. But I wanted to ask you two, what part of the body did you think was significant and giving you warning signs? I know that Dr. Rogers, she had these wake up calls in the middle of the night.
You know, I looked back, I didn't even realize that I had a couple of events the week before this happened to me where I was relaxing with my husband on the back porch on one of them where I just got really short of breath. And then I kind of moved and then I was fine. It was like, okay, that's weird. So, and then my only other one, and let Amy share hers, was that black pepper. It literally felt like I had poured myself a cup, maybe a half a cup of black pepper and swallowed it. And that was my first sign that something was really wrong.
And mine was, I called it a much more profound nudge from God. What had happened 5 years ago was a one-time thing, but obviously in hindsight, I know it was correlated. So mine again was this wave of energy that went from the left side of my chest slowly across to the right. It would hover around my throat, and at the same time would go across the back of my shoulders. And every episode would be between 2 and 3 minutes long, but it left me all summer with my traps contracted with that episode. So it was not subtle.
And they were like gentle reminders that you should pay attention to these changes in your bodily behavior.
Yeah, mine were not gentle. Mine was, this is not normal. It was obvious. But at the same time that I was waiting for cardiac results to come back, I was seeking other support. I went to a neuromuscular specialist, thinking that something might be off there. I just left no stone unturned because there was no way I could withstand having those symptoms ongoing. It was unbearable.
Thank you. Can everyone see the resource page here?
Dr. Smith, it looks like people are having trouble accessing the link. So I just put my email address in there and they can email me and we'll fix the issue and send it out today.
Yeah, the hard copy PDF should be available rather than the link. If you all just download that real quick and upload it to the session. Because the link is a private UAGC site.
Okay.
Gonna check.
And you're absolutely welcome to email. I'll put my email address in. Amy can put hers in. We can send it to you as well. Because more than anything, it's about listening to yourself. And Amy added some really great resources too that I think a lot of you would be interested in. So I'll type that in now. Any other questions? And thank you for allowing us to have such a strangely created session. We just feel like it's important. It's important for all of us to listen to one another as colleagues. In your organizations, it's important for you to ask how others are doing. There's a bigger part to care. And from a session this morning, care is not always easy. It takes purposefulness. So